And good evening, everyone, all of our listeners, everyone on social media. Thank you so much for joining us this evening. This is Ask Me Anything, Dr. MJ Collier, live. We're here to answer your healthcare questions, the only interactive healthcare forum that allows you, the listener, to participate in the discussion. So we're glad to have you here today. We're glad that you chose to join us this evening because we know you have choices and many other options for you. So thank you so much for being here with us this evening. And thank you once again. And it's the holiday season. So we are so glad that you are tuning in. It's not too late. You can text your friends, tell them to join in right now. Ask Dr. MJ on all social media. Go to the Lipodrops website where there's the link. They can join in immediately. And I'm challenging each and every one of you once again. You are my medical missionaries, my medical ambassadors. You are the key to getting good information out to people. So when you're in a gathering, when you're with your friends, y'all kicking it at happy hour, you're playing cards. We got a lot of time where we're going to spend with family in the holidays that are upcoming. So once you finish talking about the news and what's going on television and what you're binge watching, spend some time talking about your health. Why? Because your health is important. So we're here live in the studios right here, right now, and we're here to answer your healthcare questions. So, Hailey, let's do a roll call. Let's see who we have on the air with us this evening. Linda Bloomer from Birmingham, Alabama. Thank you so much, Linda. We appreciate you joining in. All right, Cindy here. Hi, Cindy from Fort Worth, Texas. And it's a little chilly out there from what I understand. Thank you, Cindy. We appreciate you always tuning in. Nishne from Missouri. I hope I'm saying that correctly. Nishne from Missouri. Thank you so much for joining us as well. Loretta McNair from Aiken, South Carolina. Thank you, Loretta, for being here. All right, Love Jones. I love that. Love Jones from St. Louis, Midwest, tuning in and right on time. Miss Audrey Ngalu from Douglasville via Shreveport, Louisiana. Hey, baby. Wilma Allen. Hi, Wilma. Thank you so much for tuning in as well. She's on YouTube. Okay. Delilah Goober. Hi, Delilah. She's on YouTube as well. Thank you so much for joining us. Sean Big Time Green from Monroe, Louisiana. Sean, thank you so much, as always, my brother. We appreciate you here. Kayshawn Garmer. Kayshawn, how you doing? My favorite Marine. Hoorah, Devil Dog. Johnny Walker from Nashville. Good evening, Johnny Walker. Johnny Walker, red, black, or blue? Derek Griffin. Brother Derek from Chicago. Hey, Derek, thank you so much for tuning in as well. Alana and AJ's friends from Orlando, Florida. All right. The #1 vacation destination. Greg Chalk from Oklahoma. Thank you so much, Greg. We appreciate you. That's a very distinguished picture. Hernando Odoms from New Orleans. Hey, Hernando, thank you so much for tuning in as well. Trayvon Waters from Mansfield, Ohio. All right, Trayvon, I'm glad to see we have so many men participating. Tremaine Hardy, tuning in from Ruston, Louisiana. Thank you so much. Miss Vicky from Texas. How you doing, Miss Vicky? Thank you so much for being here as well. Don Alexander from Indiana. Thank you, Don. We appreciate you being here. Alice Allen from Chili Chill. We appreciate that as well. And David Owens, David, Houston, Texas. David, thank you so much for being here. Now, okay, Lisa Mitchell from Beaumont, Texas. Beaumont, all right, very good. Anthony Crawford, ACNNC. I love that. So thank you, each and every one of you. Shirlene Brown from Baltimore, thank you. And we'll come back. We're going to do another roll call because we have so many people participating in tonight's broadcast. So if you've been listening to the radio recently, for the last week or so, there have been a lot of ads talking about kidney disease. And I'm so glad to hear that because this is a disease state that is basically being ignored and undiagnosed, and people have it and they don't know they have it. And so this morning's Wellness Wednesday topic on the Rickey Smiley Morning Show, I talked about kidney disease and this epidemic that has really just kind of snuck up on us as a people. 1 in 7 Americans have chronic kidney disease, or CKD. And millions are at risk. There are no symptoms until late in the disease state. And 90% of people don't know they even have it. Amongst those that are diagnosed with it for the first time, more than 50% hear the diagnosis for the first time in the emergency room. They've gotten so sick, they had to go to the emergency room and they have blood drawn and a urine test, and then it confirms they have chronic kidney disease, and they didn't even know it. And I like to say, you do fine until you don't. You do well until you finally get some symptoms, and then you have problems. So the point being, at that time, you have lost your window. Your kidneys and your liver are two unique organs that have the ability to regenerate. They can literally heal themselves if you take them out of a state of dis-ease. In other words, if you have high blood pressure, you have not been controlling your blood pressure, now you take your blood pressure medicine, your blood pressure is now controlled. Your kidneys, any damage done to your kidneys can repair itself. Any damage done to your liver can repair itself. The two organs that are unique in that way. Other organs, when the damage is done, the damage is done. All you can do is hope that you've left enough function. That's why oftentimes when people say have heart attacks, and they'll say, well, after my first heart attack and after my second heart attack in 2020 and my third heart attack in 2024, every time you have a heart attack, you lose some cardiac function. You never can come back 100%. Oftentimes, people can come back better because they change their diet, they eat healthy, they start exercising. So their post-heart attack health levels can be higher than their pre-heart attack when they were sitting around and basically watching television all day, never getting any exercise, eating a lot of greasy fried foods, etc. That would be a problem. So amongst those that are diagnosed, again, more than 50%, they hear the words chronic kidney disease, or renal failure in the emergency room. That is a problem. Late stage diagnosis usually results in dialysis. And the problem is that over 50% of people that go on dialysis die within 5 years or less. So if you go on dialysis, you really have a problem there. Plus, dialysis is life altering. Having to go on dialysis, basically, you get it 3 times per week. When you go on Monday, you feel like crap the day you get it because they literally just suck all the fluids out of you and make you feel like a prune. So on Tuesday, you start to perk up. By Tuesday evening, you're starting to feel like yourself. And guess what? On Wednesday, it's time for dialysis again. So you never really have good days. You just have bad and not so bad days. But more importantly, you are tethered to the dialysis center. So you can't travel. You can't, go places. They have a whole sub-industry of what they refer to as dialysis cruises. I didn't even know this. One of my friends who's a nurse, she shared this with me, that she would work on dialysis cruises. So because otherwise people that were on dialysis could never go on a cruise. So they go, you set up your dialysis schedule so that while you're on the cruise, you can get your dialysis. And then, now this is hemodialysis. There are other types of dialysis. There's a peritoneal dialysis where you basically put fluid inside your abdomen. So you literally are walking around sloshing with fluid inside your belly. And that fluid will exchange with toxins via the lining and covering of your intestine called the omentum. That works very efficiently, and it's almost like normal renal function. You put the fluid in, you walk around, let it exchange on a cellular level, then you drain it out and put new fluid in. So you have to continuously stay on top of that. Most people that are on dialysis at that point, they're not urinating. They don't make any significant urine, if they make urine at all. So it can be a problem. So it's a workforce nightmare. So people, once you're diagnosed, you basically automatically put on disability because you can't work and you're at risk in a work environment. So if you had a good job with good benefits, now you're on disability to take care of you, giving you health insurance, etc. But your family now is no longer eligible for the insurance that you had on your job. So that is a problem. Now, families and livelihoods as breadwinners, mothers and fathers who were responsible for bringing income to the household, to buy the groceries, to pay for the after-school football team uniforms and cheerleading and all those things. That money isn't there because that person is not working. So, it devastates the family. This affects over 37 million Americans. Over 600,000 people live on dialysis, and over 250,000 live with a kidney transplant. Now, at least a kidney transplant it frees you from the tether of the hemodialysis machine. But now you have to constantly be concerned about rejection of the organ. Although we have gotten much better with transplants, tissue matching is much better. We have multiple levels of genetic testing that we do now. And we also make sure that the organ is free of viruses, bacteria, fungal infections, all those things. So the risk is lower, but there still is risk. You still do not live a normal life after kidney transplant. You just live a more normal life than somebody that's on dialysis. So late stage diagnosis is a major burden on the healthcare system. It costs taxpayers more than, hear this number, 100 billion with a B, $100 billion per year. This is annually that we have just for taking care of people that have dialysis or on dialysis or have had a kidney transplant. So that is the cost to the healthcare system. So let's talk about the risk factors of kidney disease. Family history. Number one, you're more likely to suffer from kidney disease if a close relative. Doesn't have to be a parent or a brother or sister. It can be a close relative, a grandparent, a cousin even. In that case, if you have anybody in your family that's on dialysis, then you need to, there's genetic testing available that can determine if you are as susceptible as that person. So you can make lifestyle changes, even prevent if you know that the disease state, the diabetes, the high blood pressure is going to result in you ultimately being on dialysis. You're probably going to take better care of your blood pressure. You're probably going to take better care of your blood sugar and keeping both of those things better controlled. If you don't have that threat of end-stage renal failure on your where you're thinking about it, you're aware of it, you're knowledgeable about it, then you might not change your behavior as much. Okay, so race-based, Black, Hispanic, Native Americans, and surprisingly enough, Asians are at higher risk for chronic kidney disease than Caucasian Americans are. And so this is one of the rare times when Asians are thrown in with the rest of minorities. But it's normally the Blacks, the Hispanics, and the Native Americans, high incidence of diabetes, etc. But the Asians are at high risk along with us for kidney disease. If you're diabetic, 1 in 3 adults with diabetes have chronic kidney disease. So if you have the diagnosis of diabetes, you probably have it or are going to have it. If you have diabetes, keep your blood sugar levels under control to prevent the long-term kidney disease, because the damage from diabetes is on the cellular level. Those sugar crystals floating around in your blood are literally like sandpaper. And every time your heart beats, it's like taking sandpaper and rubbing it across skin until you finally get a raw open wound and it does damage. It heals and then it scars. And when it's no longer one cell layer thick, it can't transport toxins and filter the blood appropriately. So the kidney is not working and performing the task that it is supposed to do, which is filtration on the glomerular level. The GFR, glomerular filtration rate, goes down. That number should be 60 or higher. 60 or higher. Ideally, you want it to be greater than 90, but 60 or higher is considered normal. Anything under that is chronic kidney disease, and as the number goes lower, the stage increases from stages 1 through 5, with 5 being complete renal failure and on dialysis. So high blood pressure. If you have high blood pressure, this is the thing that's unique about high blood pressure. It's kind of a chicken and the egg phenomenon. You can have high blood pressure, which can cause chronic kidney disease, or you can have chronic kidney disease that can reversibly cause high blood pressure. So one may cause the other. Is going to be a problem. And so you have to make sure that you are controlling that blood pressure. You want to be on a low sodium diet. You want your lifestyle changes and taking your medication to improve your kidney health. There are now even the GLP-1s, the Ozempics, and the Mounjaro have actually been shown to improve kidney function. So the kidney specialist, the nephrologist, is now prescribing those drugs in people that aren't diabetic, who may not necessarily have high blood pressure, but probably do if they have chronic kidney disease. But you don't have to have diabetes. And so even though technically these medications are indicated for diabetes, they have been found to be extraordinarily effective in treating chronic kidney disease as well. So there you have it. Those are the things you need to know about chronic kidney disease, CKD. If you hear These commercials that are on television, the two tests that you need are urinalysis and a urine protein called ACR to determine what your urine protein ratios are. Protein urine ratios, and then a blood test to evaluate your glomerular filtration rate, or GFR. And there we have it. Okay, this is the People Show. This is your opportunity to ask your healthcare question. So, Holly, let's put the first question up. Alana and AJ's friends, I have a question. My doctor says one of my kidneys is smaller than the other and functioning at 30%. What can I do? Nothing except optimize the health of that small kidney. Some people have what's called agenesis of the kidney. The kidney is small or doesn't function at all. So you have a functioning kidney, it's only functioning at 30%, but that is a substantial and significant amount of kidney function. You really could live technically on with just one kidney, and that one kidney does not have to be functioning at 100%. But if you have a fully functioning kidney on one side and the other one is down to 30%, again, maintaining a normal weight so there's no stress on the kidney, drinking enough water. If you don't hear anything else Dr. Collier says tonight, drinking enough water is key. 8 to 10 glasses of water per day, not counting anything else that you drink. So you can't say, well, I had a glass of tea, or I had a cup of coffee, or I had a serving of Gatorade, Powerade, etc. That does not count. Nothing replaces water. So you get your 8 to 10 glasses of water in, and anything else you drink is just things that you are drinking. Why is that important? Because remember, I told you the glomerular filtration rate is how you determine the stage of kidney dysfunction or chronic kidney disease. So stage 1, your GFR is under 60. Now it should be 60 or higher. The higher that number, the better. Once it's less than 60, that's chronic kidney disease stage 1. The reason that it's low is because there's not enough fluid to filter. You drink more water, there's more fluid to filter. The rate of filtration goes up. So the GFR improves spontaneously by you challenging your kidneys by drinking more water. This is a very simple and elegant thing to do, and it's the most difficult thing to do. People ask me, what can I do that's natural? I don't want to take any medications, Dr. Collier. Drinking 8 to 10 glasses of water per day. Everyone says 100% of the time when I ask that question, now I say 99%. Every once in a while I get somebody say, well, no, I know I don't drink enough water. I don't like water. I don't drink water, etc. But the vast majority of people say, oh, yeah, I drink plenty of water. And they really don't. They drink maybe two bottles of water and think that is sufficient. I drink a bottle in the morning and a bottle in the evening. No, that's just getting you through it. So you want a minimum to get 64 ounces in. And you don't want to get 64 ounces in at 8 o'clock in the morning and think you're through. It's much better if you spread it throughout the day. Because if you drink a lot of water at one time, it's just going to go right through your kidneys. You're going to urinate it right back out, and it's not going to give you the benefit that you would have. So one of the things that I do when I go to a restaurant or any other time that I'm eating, whatever else I'm drinking, when I sit at the restaurant, the first thing I ask for, they say, you want an appetizer? I say, bring me a glass of water. You want cocktails? Bring me a glass of water. Make sure you've gotten the water first, because if you don't get it first, you'll never get it, or you will get it late. So I will say, give me a glass of water, then come back and take my drink water. Regardless of whether that's iced tea, or lemonade, or Jack Daniels, or Hennessy, whatever it is, I get the water first, and then I tell them, keep refilling it, keep refilling it. And usually I will take the initiative, and when I'm with a group of people, I say, bring water for everybody. And bring lemons and lime too, so people, that will enhance the possibility of people drinking their water. And then I make a show of drinking my water as well. And so if I have water and a glass of lemonade, I finish the glass of lemonade, I finish the glass of water. I get a refill on the lemonade or whatever, I get a refill on the water. That way it's always 1-to-1. That is a very passive aggressive way to virtually assure that you're getting enough of your water in. Okay, great question, Alana and AJ's friends. We appreciate that. Shy Wilson, I'm a type 2 diabetic, and I just recently found out I have fatty liver. I've had problems with indigestion and sour and foul smelling burp for 2 months. I'm getting an ultrasound done. Okay, Shy. So one, the ultrasound is only going to show that you do have a fatty liver. It doesn't. It's just a diagnostic test. There's nothing therapeutic about that. So we want to make sure that one of the things you need to do is take probiotics to help take care of that bacterial on your gut biome, the flora in your gut, so that it is predominantly the good type that will cut down on the amount of acid that you're producing, and it will give your breath a more pleasant smell, as well as gas when you pass it from below. Now, they have just gotten the indication for fatty liver for the GLP-1s. I stated earlier. That's the Mounjaros, that's the Wegovy's. Now, technically, it's only for Wegovy, which is Ozempic. Ozempic is Wegovy, and Mounjaro is Zepbound. Those, I'm going to explain why those things are that way. When the GLP-1 class of medication was first designated, they both went for a diabetes indication because they were made to lower and control your blood sugar and lower your hemoglobin A1C levels. Well, the major side effect of the GLP-1 therapy was not only controlling your blood sugar well, lowering your A1C, but you had profound weight loss while taking these medications. And so, of course, everybody wanted these drugs, regardless of whether they were diabetic or not. The problem is, if you were not diabetic, you couldn't get it technically. Your doctor is not supposed to write a prescription for it if you're not diabetic. So they applied for weight loss indications with the FDA, and the FDA said, no, you asked for diabetes indication. This is one of the reasons that the United States is so far behind oftentimes in medical breakthroughs. So they could not give you the Ozempic and the Mounjaro for weight loss only, although everybody seemed to be getting it for that. So they created with Ozempic the Wegovy. So the same manufacturer, going down the same assembly line, the same products. If it goes to the left, they put a label on it that says Ozempic. If it goes to the right, they put a label on it that says it's Wegovy. It is literally the exact same medication manufactured by the exact same company. Well, same thing with Mounjaro and Zepbound. Mounjaro had the diabetes indication. They also had an indication for kidney disease, which the Ozempic people didn't ask for. So they didn't ask for it, so they didn't get the indication. Now they have the indication. So because they had to repeat some clinical trials and additional studies. But same thing with Mounjaro and Zepbound. Same manufacturer, same assembly line. It goes down the assembly line to the left, they put a sticker on it and call it Mounjaro. If it goes down the assembly line to the right, they put a sticker on it and call it Zepbound. These are the exact same drugs, but if it's called Zepbound, it has the indication for weight loss. Now, the Wegovy has just gotten the indication for fatty liver. And it is the only other treatment was available was a medication that costs about $50,000. Hear me, $50,000 per month to treat fatty liver. And it's not as effective as the GLP-1s are. So the GLP-1s, I'm pretty sure it's a class effect. They all will have that indication soon. So weight loss, all of these benefits are due to the weight loss. If you're losing weight, you're losing fat. If you're losing fat, if you have a fatty liver, guess what? If there's fat in the liver, you're going to lose that fat as well. So it's going to give you great benefit in doing so. So that will be a treatment. Don't let that be the final treatment. You can start that immediately, Shy. So ask your doctor about GLP-1 therapy, or just use the name Ozempic or Mounjaro or Wegovy. Your doctor should know this, so they ought to be able to lead you down that pathway. Because if you try to get the Wegovy for weight loss only, your insurance company may say no. But with a diagnosis of fatty liver, the same company that denies and denies and denies will say yes enthusiastically, because it is the only treatment that is available that is reasonable. You can spend $1,600 a month for the Wegovy, and the price of that is even coming down. You can spend $50,000 a month for the other drug that has the indication for fatty liver. So there you go, Shy. Great question. Make sure you follow up on that and tell all your friends. Okay. Now let's go over here to the scroll right here. I see Pit Resident, is krill oil better than fish oil? Krill oil is an omega fish oil. It just comes from krill, which is baked like miniature shrimp, and so it is a good omega oil. But all the fish oils are great. If you are allergic to fish or seafood or shellfish and cannot tolerate, there are flaxseed oils, which is an omega-3 fish oil, and that is plant-based, and it can be well tolerated by somebody who is allergic to fish. Okay, all right. So I say a friend, since he's lacerated his bladder from an accident he had about 3 years ago, to help with his urgency to go. Okay, yes, the Kegel exercises are very good for that, and they can really help with that. And that's where you basically urinate and you squeeze the urethra to close off the bladder to stop urinating. So you urinate, you stop the stream. Urinate, you stop the stream. Urinate, you stop the stream. And everybody thinks they can't do that, but you can. And it's very, very effective in stopping that. It will help with bladder leakage. So if you have leakage when you cough or you sneeze, very common in ladies, particularly if they've had more than one vaginal birth. It does damage down there, and they may get urinary leakage or what we call stress incontinence. Kegel exercises are very good for that. Amazingly enough, so is frequent intercourse. As you squeeze the vagina down to make it feel better for you and your partner, that is a Kegel exercise, basically, and that will give you some great benefit as well. Okay, Shy Wilson, thank you. I take those in from my A1C 6.8. I will lose more weight. Okay, 6.8 is good A1C, Shy. Anything under 7 is considered good control of your diabetes. You don't necessarily have to go up in dosage. The weight loss with an GLP-1 is not necessarily dose dependent. So if you're getting a good response at a dose that's less than the maximum dose, so I like to say titrate up to the maximum tolerated dose, and that optimizes your weight loss, because going to a higher dose may not make you lose any more weight, but it may give you some problems with the side effects, nausea, vomiting, diarrhea, etc. Don says, I'm on Zepbound. I put on a significant weight post-chemotherapy. My kidney levels are bad and my BP was bad. I'm now losing weight off BP meds and kidney levels are getting better. Don, you are a poster girl for GLP-1 therapy. The Zepbound has done everything that it should do with you and for you. It has made you lose weight. It has improved your kidney function, and you're off blood pressure medications now. Now, let me make this clear. Weight loss is great for helping control blood pressure, but it may not necessarily result in you coming off blood pressure medications. Some of my worst and most difficult to control blood pressure patients are what I like to call Ike Turner skinny. They're tall, they're lean, they have almost no body fat. They are literally, a BMI is 27 or less, yet their blood pressure is uncontrolled and off the chart. So blood pressure, weight loss always helps making it easier to control your blood pressure. You may have to you may be able to come off some medications or cut the dosage down on some medications, but it doesn't always result, because there are other factors that are important in reference to blood pressure. Charlene Brown, this morning you recommend a med that you burn fat while you sleep. What's the name of that again? Charlene, that is not a medication. It is a supplement. My supplement called Lipo Night. It contains melatonin. Melatonin is a sleep aid that helps you get a good restful sleep where you go to the dream stage, the REM sleep level, so you do not make the stress hormone cortisol, which is what most of us do at night because we don't sleep well. So that cortisol makes you, it basically makes fat go straight to your abdomen. And so the Lipo Night stops that from happening. And then for the fat that's already there, it contains not 1, not 2, but 3 fat burners that literally burn fat while you sleep. So go to the website right now. If you're on this broadcast, there are always specials available for you. Go to the lipodrops.com. It's scrolling at the bottom of the page. 15% off code hitting in selected videos. There you go. Lipodrops.com. Look for the Lipo Nights product. Makes you lose weight while you're sleeping. It is literally one of the best products that we have available in the Lipodrops line. Everyone seems to love it. Okay, let's go back to the questions, Hailey. How do we restore my taste buds and sense of smell? Pam, if you lost those due to the COVID or the coronavirus, that is a common phenomenon. It's called agnosia, is the loss of smell, and ageusia is loss of taste. So ageusia and agnosia will cause the loss of, this is all an inflammatory problem. So how do you treat inflammation? You treat it with anti-inflammatories. The most natural anti-inflammatories you can get, vitamin D, the body's amazing natural anti-inflammatory, and available on the Lipodrops website at a therapeutic dose of 5,000 international units per day. 5,000 international units per day, a caplet that's easy to swallow, that will decrease inflammation. And then omega-3 fish oil. The omega-3 at 1,480 milligrams per capsule, because you need to get at least 3,000 to 4,000 milligrams in per day to get any benefit from it. The most common over-the-counter dose is 1,000 milligrams. Most people take 1 or 2 of them. It is a total and complete waste of time, so you can't do that. So those are the 2 things I recommend. It's not going to be an instant. You're not going to take a pill today and your taste buds and sense of smell have returned tomorrow. But I state unequivocally that it will decrease the inflammation throughout your body. Also, one of the things you may want to add is probiotics. Probiotics is God's gift to inflammation and GI changes the GI biome to one that's more healthy. And since taste and smell are literally a part of the GI tract, you taste food because of the way the food smells. You smell it and it gives you a taste. Those 2 things are intimately involved in making your dining experience more pleasurable and enjoyable. You like the way the food smells. That's why when you walk into a room at Thanksgiving and you smell all the good aromas in there, I like to say smells like home. And then you have a Pavlovian response. Your mouth starts to salivate and that hunger kicks in and you really can't wait to get to the food. So great question. I saw a question in the trend there. Don, can you take Lipodrops with Zepbound? Don, not only can you take Lipodrops with Zepbound, but you should take Lipodrops with Zepbound, because all the GLP-1s will result in weight loss and fat loss, sometimes in places you don't necessarily want to lose it. You can lose fat in your face and it will change the way that you look. Your face can become saggy and it can create an unpleasant look that's not you, and it literally is very difficult to fix and or repair. There are literally people that are now specializing in GLP-1 face therapy. They will take fat from your buttock or your abdomen and inject it into your face to fill your face out once again so you have a more natural look. But the Lipodrops, when I was reading this article and they were describing other treatment options, I was like, well, heck, that's what the Lipodrops do. So the Lipodrops make you lose fat from the areas that you need to lose fat from, like the back of the arms, across the back in the bra line, the abdominal area. But it will preserve breast fat, and more than likely it will preserve fat in your face so you don't get the GLP-1 face. So you can take safely the Lipodrops, 1 dropper full under your tongue, hold it for 2 minutes, then swallow it. That is where it works. It does not work in your stomach. So the biggest problem that I have is people getting it and taking it inappropriately. You squirt the Lipodrops under your tongue. You hold it under your tongue for 2 minutes. That is where it works. It is literally absorbed in an effective manner, just as if you were getting an injection of the components of what's called Lipovite, but now Lipodrops. So if you do that, it's going to help tremendously in your weight loss journey, and it will help so that you don't get the saggy skin and other problems you can if you have a dramatic weight loss. If you're going to lose more than 60 pounds on the GLP-1, you definitely want to do that, because it will shape your body in a whole different way than if you just lose the weight and have a lot of loose skin hanging down. Okay, thank you very much. Holly, Jennifer Monroe McKee, double hyphenated fem gal. Good evening from Jackson, Mississippi. My internal medicine doctor put me on 5 milligrams of amlodipine, and after seeing my cardiologist for a yearly follow-up visit, I have any heart problem, he increased it to 10 milligrams. Since taking the 10 milligrams, I have swelling in my ankle and the lower part of my leg. What do you advise? Jennifer, one of the major side effects of the amlodipine, which is a very, very effective, it is the #1 most prescribed blood pressure medication, and it is very effective in people of color, African Americans. The problem is that at a dose of 10 milligrams, it can cause fluid retention and swelling of the ankles. So one of the things you can do is take a 5 milligram tablet twice daily. So instead of taking 10 milligrams in one dose, you take them roughly 12 hours apart, which does increase your pill burden. The other is combining a lower dose of the amlodipine with another type of medication. That medication I'd recommend would be an angiotensin receptor blocker class drug, such as losartan or olmesartan. They work on the cellular level by opening up the efferent vessels, so that as blood flows down to your body, down to the capillary level, a lot of that fluid is extruded into your lymphatic system. Your lymphatic system carries it back to your heart, and it stays in circulation. Because once you get down to the cellular level, you just really only have room for the red blood cells, not the fluid associated with them. So this is a normal process. The problem is amlodipine opens up the afferent arteries. So you got a big pipe on this side and a little pipe on this side. And so all that fluid starts to extrude out and you get fat ankles. Well, though olmesartan and those classes of drug open up the efferent. So you got two big pipes now that fit together perfectly, and the fluid is not extruded out. And so that decreases the fluid levels. So a lot of doctors will also use a low dose of a diuretic class drug such as hydrochlorothiazide. That really does not fix the problem, but a combination product like the olmesartan or the losartan, I like to use them because their efficacy, how well they work, increases by 50% if you add a low dose of a diuretic. So the most common dose that I use is 40 milligrams for the olmesartan, 100 milligrams for the losartan. Then I'll add 12.5 milligrams of hydrochlorothiazide. So it'll be olmesartan 40/12.5. And that will give you the benefits of a mild diuresis without over diuresing you. People using higher doses, 25 or 50 milligrams of the hydrochlorothiazide, or even going to Lasix, which is a major diuretic, 20 or 40 milligrams. Now, you're just treating the symptom and not treating the problem. The other option, of course, is to change from the amlodipine to another class of medication. The predecessor or precessor to amlodipine was called nifedipine. It is a different class per se. It comes in 30, 60, 90 milligram tablets. It works amazingly as well, but doesn't have the swelling as a major side effect. It can cause the swelling as well, but amlodipine really causes the swelling, and this may or may not. So I oftentimes will take my patients off of the amlodipine if they don't want to go to the 5 milligrams twice a day and they need that much to control their blood pressure. Then I will take them off that and put them on the nifedipine or Procardia at the 60 milligram dose. But again, I have the option of going up to 90 milligrams on that. But the best way to treat and control blood pressure is by using lower doses of multiple medications than using a high dose of one medication, regardless of how effective it is. Because when you're controlling the blood pressure from this side, you're pushing, eventually your body will adapt to that. But if you have one coming from this side, one coming from this side, and they meet in the middle, and then together they push it down lower at lower doses, that is a much better way to treat blood pressure. And that is one that has evolved in the minds of healthcare providers, because before, the protocol was place a patient on one medication, increase the dose to the maximum dose of that medication, then reluctantly add a second medication. If blood pressure is still not controlled, it go increase to the next highest dose until you're at the maximum dose of that medication. But why do that when you can start off with lower doses of 2 or even 3 medications, which is the most common thing, and then you'll get control of the blood pressure without the potential for all of those side effects. So that is what I recommend, Jennifer Monroe McKee. That should do it for you. Okay. Kelster, 39. Good evening, Dr. Collier. My elbows hurt. The pain is so bad at times it wakes me out of my sleep. What's causing this? That could be your sleep posture. I found that my elbows also do that. If I have my elbows in an abnormal or unusual posture, I recommend highly sleeping on your back. It is the most comfortable and relaxing posture, but a lot of people, it's very difficult to change your sleep posture. So if you're used to sleeping on your side in particular, your elbows cannot tolerate your body weight. So if you have your elbow trapped under your arm or your body when you're doing that, that could be a problem. So you don't want to do that if you can help that. So if you're sleeping on your stomach, then you have one arm extended and the other arm somewhere. You call that the swimmer's position. Again, not a comfortable place for your extremities, your arms or your legs. Now, another possibility is that you have arthritis in the elbows, but that shouldn't be the only joint that's affected. It may be that the amount of insult to the elbows is greater, so you're feeling it there. But when you think about it, if it's arthritis, it should probably be affecting your knees and possibly your ankles or your hips as well. But the problem is inflammation. You take an anti-inflammatory, you take Motrin, Advil, or leave something like that in the evening with your dinner, and you should be able to go to sleep and not have this problem at night when you're sleeping. You should wake up, not be as stiff, and feel much better. So that's one of the things that Dr. Collier will do. You can take it at night before you go to bed, but if you take it after your dinner, it should not irritate your stomach. And always, 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 when you take any medication, but particularly an anti-inflammatory, you take a full glass of water, not just a sip to get it down, but a full glass of water that will allow that tablet to dissolve, get out of your stomach so it won't irritate the lining of your stomach, and get into your system where it will provide relief of this complaint that you have. If it persists beyond those simple interventions, then you need to go to the doctor and get evaluated. You don't necessarily need imaging. Everybody wants x-rays, MRIs, and CT scans. Those tests are they are imaging. You hurt before you go take a picture of it. You take the picture of it, it still hurts. Nothing changes. Maybe what they call it might, but it's very easy to diagnose these things with a comprehensive physical examination and sometimes blood work. You don't have to take pictures of everything that are very expensive. So at the end of the MRI that you beg the doctor to do, they're going to tell you the same thing, that you have osteoarthritis in the elbow, but your pocket's going to be hurting now by the amount of about $5,000 for an MRI. So that's where we are with that. Okay, great. Anitra Ransom says, hello, I'm thinking about getting the Lipodrops to help with my weight. My question is, are there side effects like memory loss from taking these drops? Definitely not memory loss from that. There should be no issues with that. It's perfectly natural. It's compatible with any disease state. You can have high blood pressure. You can take diabetes because it has no stimulants in it. It does not affect your blood sugar, your blood pressure. It's compatible with any prescription medication that you are taking. So there should not be any issues with it from that perspective at all. So safe, and you should get great benefit from it. Okay. Latanya Hall says, good evening, Dr. Collier. I have GERD, that's gastroesophageal reflux disease, and I'm on a RX of omeprazole. Okay. I lost that. So omeprazole, I think says, should I get an endoscopy? What can I do? If that is not relieving your symptoms, this is an anti-acid. It stops your stomach from producing excess acid. You're still having problems. You may have what's called a hiatal hernia, or you could have esophagitis, where the reflux causes irritation and damage to the lining of the esophagus. So you have that. Okay, I have GERD. I'm on a treatment. I take one in the AM and PM, but I have dizziness and chest pressure and increased heart rate. Head endoscopy. What else can I do? Okay, those things are dizziness and chest pressure are not necessarily related to the gastrointestinal tract. Oftentimes, when a person is having heart issues, they think it's indigestion, and people have either not gone to the emergency room or been dismissed, particularly women. They go to the emergency room, and the emergency room doctors not consider heart disease as an option because it was thought that women didn't have heart attacks because they didn't have stressful lifestyles like men. Well, we quickly realized that is the exact opposite. Most women have more stressful lives than men, and they are equally susceptible or more susceptible to heart disease. And this is a big problem. That is the entire red dress campaign that happens every February, talking about women and cardiovascular disease. So if you've had that and not gotten relief from that, you had an endoscopy, you've had the full GI workup, now you need to be seen by a cardiologist to make sure that the dizziness in particular sounds like you could have an arrhythmia, atrial fibrillation, atrial flutter, several different things. And chest pressure, if not relieved by the omeprazole, then you have to rule out cardiovascular etiology. You have to check and make sure it's not your heart. Okay, Latanya, please follow up with your cardiologist. Ms. Love Jones, can we talk about carotid atherosclerosis? Of course we can. Your carotid arteries are in your neck, and they go up and then they branch off about here, and the two branches that go up all the way to the brain. One goes internal, the internal carotid, the other is the external carotid. That is the anatomy of the situation. Well, because every time an artery branches, that causes abnormal blood flow. Normally you want laminar flow, so the blood is literally going over itself in lines that are smooth, like air going over the airplane's wings. Well, when you have a branch in the artery now, you got turbulent flow. At the point of turbulence, it does a little irritation and damage to the blood vessels, so your body repairs that by laying down cholesterol plaquing, or atherosclerosis, as you state. Now, anybody that's probably in that fourth or fifth decade of life has some atherosclerosis in their carotids. You got it in your heart. You got it everywhere. Everywhere you have a blood vessel. But they look for it in the carotids because it can be associated with heart attacks, strokes, dizziness, blindness, all kinds of issues. But to have a significant amount of problems with blood flow, that stenosis or obstruction in the blood vessel needs to be 80-90%. Most of us walking around have 20, 30%, and we live just fine with it with no problems. If there is a greater amount of obstruction, two things that can be done. They can place a stent in it, just as they put stents in your heart, or they can bypass it just as they do in the heart. They hop over the obstructed area. That is called a carotid endarterectomy. That is where they basically, again, they put an extra, they harvest vein out of your leg, and they go over the obstruction. The problem is that oftentimes during the procedure, little fragments of cholesterol will break off, and it can cause you to have a stroke. So this can be a problem. But if it's less than 70, 80%, and you're not having any problems, then you're just like everybody else. Now, there are companies now that will go out and they do these health checks, as they call them. They do EKGs, they do ultrasounds, they do carotid artery scans. They scan your abdomen for what's called an abdominal aortic aneurysm. And oftentimes they will find carotid plaques or atherosclerosis in the carotid arteries of the neck, because everybody has it. So it's never a surprise when it's there. But again, if it's not more than 70, 80%, I would not be concerned about it. Most doctors will go up to 90% before they really think it's going to be a problem, unless you're having symptoms. And that usually means that if it's there, it's probably a little deeper. They just can't get the ultrasound in there to find that out. They would have to do a test with contrast to look at all the blood vessels in the head. And that is a little more invasive, whereas this test is kind of a screening test. But so that's where we are, Ms. Love Jones, with that. So I don't think it's going to be a real problem unless someone has told you that the obstruction is more than 80%. Then something has to be done from an intervention perspective. But if you want to protect yourself, the simple basic therapy is a low dose aspirin, 81 milligrams, one pill, one time per day. Go to the place where everything is $1.25, buy you a big bottle of aspirin, and just take one every day. And that's pretty much all you need. If your doctor has told you that you have high cholesterol, then you need to be taking a cholesterol lowering medication. This is not the time to be, I want to be natural. I'm going to stop eating fatty foods, because one, you're not going to do that, because it's fatty foods and everything you eat pretty much. Because one thing about fat, it makes food substantive and palliative. The more fat, the higher the fat content, the better food tastes. So we like fatty foods. But let's say you make a commitment. I'm not going to eat any fatty food. I'm going to eat plants and nuts. That's still not going to reverse what you have. So taking a cholesterol lowering medication will slow down progression or stop progression and cause some slight regression. It doesn't clear it out. That there's no drug that does that, but it can help with that. Okay, Ms. Love Jones. Cynthia Burris, what do you use to help with bacteria in the mouth? Cynthia, again, the typical mouthwash solution will do that. A solution of 50% warm water and peroxide will do it as well, and it is very effective. The number one thing that's utilized to whiten your teeth is hydrogen peroxide. They make a gel, they give you these trays, and the peroxide will whiten your teeth. Well, guess what? You can gargle with peroxide as well. Just don't do it with straight peroxide out of the bottle. It can burn the delicate lining of the mouth and tongue. But if you mix it 50-50, warm water and peroxide, you can gargle with it safely. And it will not only give you the freshest breath that you have ever had in the morning when you wake up. If you do that at night, it will help take care of that. Also, you have to be careful and conscientious about a diagnosis of periodontal disease, that you could actually have infection in the mouth and in the gums. That's going to require antibiotic therapy and possibly what's called a deep scaling, where they go in and they scrape all that infection from under the gums. They literally take a scalpel, cut the gums away from the teeth, clean out the bacteria in the pus pockets, and then sew the gums back up. That process is a bit arduous, but it does work. So this is a situation where you might want to get screened by your dentist as well. And again, make sure you're flossing correctly. Flossing is very important to get those food particles from between your teeth as well. Okay. All right. Don says, place my order with y'all. Can't wait. Thank you, Don. We appreciate you. Make sure you go to the official Lipodrops website, lipodrops.com. You should see my picture. If you do not, then you're not on the correct site. There are bootleg sites out there that exist. People know the benefit of Lipodrops products, so they have fake drops on the market. And they some even have Lipodrops on the bottle, the word Lipodrops, but they got weird looking labels and stuff. Look and see what our products look like. Make sure you're getting them, and make sure you only order from lipodrops.com. Okay. Courtney Davis, I've been having sharp pain in my vagina. I got tested for STI. Everything is negative. I'm still having the sharp pains. I don't have any cysts or anything. What do you think? Okay. We want to make sure that you have had you got tested for STIs, but they do a thorough pap smear on you, testing you for that. You also want to make sure that this is not coming and originating from outside the vagina. That can be your ovaries. You need a pelvic ultrasound to determine that. And do you just have the pains spontaneously, or is it only when having intercourse? Those are very distinctive types of pain. The pain with intercourse is called dyspareunia. You want to make sure that that's not the case. But if you're still having the pain, the main thing is we don't stop looking because the sexually transmitted disease test was negative. Most sexually transmitted disease screenings test you for chlamydia and gonorrhea. They don't test for 100 other organisms that could be there that aren't necessarily sexually transmitted, but can be sexually transmitted. So there's new urine and genetic testing. They can test the fluids from your vagina as well that will test for so many different organisms that can be causing an infection, but it doesn't have to be infectious at all. It could be something else. So again, the main thing is you're having the pain and it hasn't stopped. And you do not want to, this is altering your lifestyle, I'm sure. You don't want to have sharp pains in the vagina. That's not good for anybody. It's not good for your interpersonal relationship. It's not good for you. When that happens, you can't think about anything else because it gets your attention, so to speak. So everything in your life is compromised. So you need to have a doctor that's going to go the extra length to find out what the problem is. But my next step would be I would at least get a vaginal ultrasound. It can be intravaginal or it can be just through the belly to see and make sure you don't have no ovarian cysts. Endometriosis. There are a lot of other issues that can cause that problem. Okay, Courtney. Jerry Thomas, I'm 46 years old and I feel weak in my body, especially my hands when holding anything slightly heavy. I'm 6 feet, 370 pounds, muscle built. At times I feel sluggish and non-energetic. What do you recommend? Jerry, a comprehensive physical examination, and then I would also check thorough blood work that would include a full thyroid panel, checking you for anemia. There are multiple disease states that can give you all of these symptoms. You 6 foot even at 370 pounds. So technically, that's going to create some problems. I'm going to see if I can calculate your BMI in real time. Okay, and I'm having trouble getting to it, but just pull out your cell phone and go to BMI calculator. You can download them anywhere and to see. And if you meet that criteria, you might just need to lose some weight. And that might be to answer your questions. But this is a problem. If you're having weakness all over the body, there are disease states such as myasthenia gravis. There are other neurological problems that need to be ruled out. You're only 46, so the age is not the issue. The size and the weight could be definitely contributing to your fatigue level and your feeling sluggish. I check your testosterone level as well, your full thyroid panel, all of those things that would be part of a comprehensive physical examination just to see if you can get to the bottom of that. Okay, Jerry, great question. Katrina Marshall, I have a cluster of bumps between my breasts for nearly 10 years. I can't bust them or squeeze or get the head out. Same or on the inside of my labia minora. What can I do? Okay, these are sebaceous cysts more than likely. There are some other things it could be, but from what you described, particularly since it's also between your breasts. Now, that's usually caused by, for all practical purposes, ingrown hair. Every hair on your body has associated with it a gland that oils it called a sebaceous gland. That oil is called sebum, and the sebum is to coat the hair and give it a nice oily glow. Well, if the glands get, the skin grows over them or they get obstructed in some form or fashion, they don't stop making the sebum. The sebum continues, and that's when you get the bump. And you can't squeeze it usually because the skin is too thick over it and it's closed off. Now, something like exfoliating the skin might allow you to unroof them and allow you to get it, but you might have to go to the dermatologist to get there's special instrumentation that can do it. that can extrude what's inside of it. And then, also same thing in labor minority. If you're shaving yourself downtown, down below, you want to make sure you're using a shaving gel, not just soap or not a shaving cream. You shave with a good razor, not the cheap razors that you buy in the checkout stand, because that's what everybody buys. They buy the cheap razors at the checkout stand where they're 10 for $1. Well, buy a good razor that has multiple blades, at least 3. Most blades have 5 now. And when you shave, one, you clean the area, wash it out well. Then when you shave down. You rinse. You shave down. You rinse. And then wash your face again after shaving, or wash that area again after shaving, and make sure, because if you turn that razor up and come up, which gives you a closer shave, then you're going to create the problem. So when you first start shaving down, black men and black women shave down. Then you're not going to feel like you're getting a closer shave as you could. But after you've been doing it for a couple of weeks, it will soon be baby smooth, and you'll be very happy with that result. Okay. Lynn Hanson, what is the range your cholesterol numbers should stay within? I've been told your numbers should be under 200. That's exactly right, Lynn. But also, that's for the total cholesterol. You want a full lipid panel, which will break the cholesterol down into the HDL, high density lipoprotein, the good cholesterol. That is the one that prevents you from having a heart attack or a stroke. That number should be 40 or higher. The higher that number, the better. And the LDL, low density lipoprotein, the bad cholesterol. That is the one that makes you have a heart attack or a stroke. That number should ideally be less than 100. Anything in the 70s is considered excellent. And then triglycerides, which are meal specific. Your triglyceride level can be normal. You eat something, the levels shoot up 300 points in 30 minutes, an hour, and then 2 hours later they're back down to normal again. That is what's supposed to happen. So that is the reason to do a fasting lipid panel. Your actual cholesterol level and the breakdown of the good cholesterol and the bad cholesterol will not vary substantially with a fasting specimen versus a postprandial, meaning you just eating. You can do that and you won't see any significant difference. The fasting is particularly for the triglycerides. But if you're just doing the total cholesterol, HDL, and LDL, break those numbers down, because your total cholesterol can be perfectly normal and your LDL, or bad cholesterol, be too high. And that increases your cardiovascular risk, meaning you're at high risk for having a heart attack or a stroke, even though your total cholesterol is under 200, because the doctor did not look further and get the real information, which is what your ratios are. The ratio of good cholesterol, bad cholesterol. And now they have a thing that the lab will measure called non-HDL. So if HDL is a good cholesterol, non-HDL is anything that's not good cholesterol that's showing up in your total cholesterol levels. And all those numbers should add up to whatever your total cholesterol is. And if the ratios, you can have a total cholesterol that's higher than 200, but you have a HDL, a good cholesterol, that's over 100. And so that's a good thing. And you don't have to bring that down. You don't have to fight with that at all. That's actually pretty good. So that should be, that's a more thorough and efficient evaluation of what your total cholesterol should be, and one that your doctor should explain to you and review with you. That is why I don't like this system called MyChart. You go get blood work, they put it on MyChart. Nobody ever tells you what anything means. And they bring it in here. They bring their cell phone. I want you to look at my MyChart and tell me what these numbers are. No, Dr. Collier is not going to do that, because I didn't order the test. I don't know what it is. But if I order a test on you, I am going to literally sit down and go over every test result with you, explaining what everything means. If something is abnormal, what we can do to change it, improve it, ways to get around it. Is it really important or is it insignificant? There are a lot of times the labs are what we call within the margin of error. They're only 1 or 2 points up, and that doesn't mean anything. Sometimes it can be slightly elevated, and it has a lot of significance. So you may say, oh, my total cholesterol is only 205. It should be less than 200, but that's not bad. Yeah, but then your LDL is 170, and it should be under 100. So you need to know these things, and it needs to be explained to you. It's one of the things that we like to do when we order lab tests. We don't just order them, we review them with you thoroughly. Okay, final question, Hailey. Let's put it up there. Nishne, how do I get rid of recurring boils for good? The most common area to get boils is under the arms and what's called the axilla area. There has been a drug that has been created for just that phenomena, but oftentimes boils are caused by staphylococcal bacteria, which everyone has on their skin. Normally, the staphylococcal bacteria is a pathogen that you live with symbiotically. It doesn't bother you, you don't bother it. And as long as your skin is intact, if you don't have a scrape, cut, or some opening in the skin that allows the bacteria to penetrate, then you're perfectly okay. But if you have rough skin or open skin, if you use an exfoliant too aggressively, a loofah sponge, and you're scraping the skin, then that bacteria can enter the skin, and then you get these problems. On your sitting area, the back of the thighs, also common areas where people get boils because they have insulted those hair follicles that I spoke about earlier, and they get staphylococcal bacteria in there, and they get infected. So one, shower or bathe with a good antibacterial soap. I recommend Dial the White Bar or Lever 2000. Lever 2000 is the highest antibacterial soap. This is not the time to go natural. This is not the time to do, I don't like to use, there are people that say I don't put soap on my face because they said it messes with my makeup, etc. No, you need to use soap from head to toe, thoroughly making sure, and leave the soap on for a second. Let the soap suds sit on the skin for a second so that it can kill bacteria. One of the things that we oftentimes do is once we get soap on the eyes or in the eyes, it starts to sting. So we rinse it off immediately. So gently scrub around your face and eyes with the soap. Let it sit there before you rinse it off immediately. So take a bath in warm, not scalding hot water, because scalding hot water will open up those pores and allow that bacteria that's remaining on your skin to enter those pores and cause those infections. So sometimes it requires a continuous dose of antibiotics that are very good for skin infections. Doxycycline is one of the ones, but there are several others that you could take, and you would take them longer than the usual. The normal course is 7 days. You may take it for 15 days for a skin infection. It kind of just depends. So something you need to work with your healthcare provider. They can do a culture, determine what the bacteria is, make sure it's not some weird bacteria that's resistant. There's one called MRSA or MRSA, methoxin resistant staph aureus. So still the same staph, but a super staph infection, and one that you don't want to be bothered with. Okay, that was the final question, and we're going to bring it home right here, right now. I want to thank each and every one of you once again. I'm sorry we didn't get to everybody's questions, but that's why we want you to tune in next time so that you can do that as well, because this is Dr. MJ Collier. Why? Because your health is important. So we want to make sure that you join us next time. And thank you once again for being here tonight on the Ask Dr. MJ. Why? Because your health is important. Facebook Live, Instagram Live, broadcast, the only interactive forum that allows you, the listener, to call in or write in or sign in or log in to ask your healthcare questions. So remember, you are my medical ready references. We want you to go out in the community, share this information with your friends, your family. I promise you, I'm keeping it 100 at all times. I make sure that you know that the information that we give you is accurate and that we're doing that. Nyla Pruitt says, are you taking new patients all day, every day? I have people that fly in from all over the country, but I'm right here in the city of Atlanta, and you can come see me at any time. We are so happy to have you, and thank you all once again. We will see you next time, and thank you so much. Your health is important.